Health authorities say they are collaborating with neighboring states considered to be contagious to checkmate the further spread of diphtheria into the Federal Capital Territory through border surveillance. This follows the death of a 4-year-old out of 8 other suspected cases from a community in the FCT. We have details in this report.
Nigeria has reported diphtheria outbreaks previously, with the most significant reported in 2011, affecting the rural areas of Borno State in the northeastern part of the country. The disease can affect all age groups. However, unimmunized children are more at risk. The 8 cases were reported to the Public Health Department of the FCT 2 weeks ago when the breakout was established. The department confirmed that the disease was imported from neighboring Niger State. Only 1 sample collected out of the 8 suspected cases recorded in the Day community of the FCT came out positive after results of samples were taken. Diphtheria is caused by bacteria with symptoms relating to fever, runny nose, and breathing difficulty. Transmission is through sneezing, droplets, coughing, and contact with infected persons. Authorities advise that sufferers who develop symptoms go into isolation and notify the FCT Disease Surveillance Notification Officer or the Emergency Operations Center. Authorities of the FCTA are now advising residents to take their personal hygiene seriously, as well as ensure that all children are fully vaccinated with 3 doses of the pentavalent vaccine as recommended in the National Childhood Immunization Schedule in order to reduce the risk of infection. Diphtheria was earlier reported in Kano, Ondo, and Lagos states in January, and a national alert was sent out on the outbreak, which triggered a national response. Kemi Balogun, TVC News, Abuja.
Let's talk now to acting epidemiologist, FCT Public Health Department, Dr. Teresa Nwachukwu. Thank you for joining us on TVC News at 7. Just how fatal is this infection and what symptoms should people look out for?
All right, thank you very much. And let me apologize. I'm driving home. I haven't gotten home. I had to park somewhere, so it's really dark. And I can barely see myself. I hope you can see some sort of visual. All right, so I really apologize about the visuals. So yes, I think what I can say is that in 2011, there was an outbreak of diphtheria, and it was really bad. Somewhere in Borno State, right, with about 98 cases and about 12 cases that people that died, giving a case fatality rate of about 21%. So extrapolating from this, you could say that from that history, you could have, without treatment, up to 20% of people that die. So the disease can be fatal if it is not well managed, right? It can be fatal. And why? Because it is affecting the respiratory tract. We breathe through our noses, our ears, our noses, and then through the pharynx, and then the larynx, and into the lungs. So if that way is blocked, then individuals who are sick are unable to breathe. And if you cut off the windpipe, you cut off the respiratory system, you're better out of the individual. So yes, it can be quite fatal if it is not well managed.
So we hear the outbreak has killed a 4-year-old in Abuja. How many suspected and confirmed cases have since been reported? Well, probably we'll get back to Dr. Teresa Nwachukwu, acting